All right, why don't we get moving? Hello, everybody. Again, my name is Andrew Spiegel. I have the pleasure of being the board chair of the World Patients Alliance. And we're really proud today to present to you this webinar, The Heart of Healthcare, Celebrating Our Nurses. That's an easy celebration. We all know that nurses are the backbone of our healthcare system, the ones that we rely on the most when we need care, and the ones that spend the most time with us, and the ones that are primary healthcare providers in a large part of the world. So we're really honored to get the opportunity to thank our nurses today. We could go to the next slide. Just a brief introduction of the World Patients Alliance, very brief, and then we'll jump right into our content. Next slide. Next slide. This organization was co-founded. Now we're almost at our 5-year anniversary, but we've grown a long way since then. And administratively, by the way, as all of our webinars are, we have multiple languages being broadcast through this Wordly that we use. There's instructions right here on our page, but you can change the language to your language and hear this entire presentation with more than 50 languages. So next slide. As I said, we've been around for now almost 5 years. We're about to hit our 5-year anniversary. And we are an umbrella organization representing all disease areas. And we are the largest umbrella organization that's doing that kind of work. So, well, we're really proud to present webinars to all of our constituents and members every month. Next slide. And it's part of what we do based on what you ask us to do. I can't see these numbers too well on my phone, but I believe it says we're now at 619 members from 132 countries. So we really are representing most of the world by far now, and really proud of all the work that the team has been putting together in gathering these members, the right members, getting them through our membership committee and getting them approved. So we welcome all of our great members from around the world. Next slide. I am going to introduce you to our powerhouse co-founder, our board member, the person who ran the Chronic Pain Foundation in America here for more than 4 decades, Penny Cohen. Penny's going to take us through today and our webinar and thanking our nurses. So I'm going to turn it right over to you, Penny. Thank you.
All right, thank you, and good morning, everyone, or good evening or afternoon, wherever you are in the world. So what we're doing is doing a campaign to celebrate nurses, Heart of the Healthcare, celebrating our nurses, which is really the heartbeat of the healthcare today. And I think they're really under-recognized. So next slide, please. We have some really good talks for you. The first one, it's a blank slide. Oh, it's a video. Oh, okay. I didn't know this. Hang on before you do. This is just a little video that we created to sort of recognize nurses. And so I'll go ahead and play that for you. Go ahead and play, please. Oh, we lost it. It's going to come back. Technical difficulties. Here it is.
We are the World Patients Alliance, and it's a patient's tribute to the nurses. What's at the heart of healthcare? Our nurses. They come together to answer their calling, to care, to comfort, to heal. They dedicate themselves to the lives of others. They give their unfailing attention to us in the day. They watch over us at night. They work with strength and grace. It's a work of sacrifice and selflessness. To appreciate them occasionally isn't nearly enough. To thank them is just a start. We owe our dignity to them. We owe them our lives. Without them, we quite literally wouldn't be.
So that, I believe, is also on our website. So please feel free to look at that again. And again, we will be focusing on the nurses throughout our campaign in Cape Town. We have a number of different little events. We have letters that we'll be asking you to write. We have an opportunity to do a video. There's all kinds of badges and things. So please, when you register, you'll find out all of these things. So hopefully those people who are live in Cape Town, those who are not, I believe there's still, there's a session for the nurses, more information. So this is our agenda for today. We really have short time. I would rather give the speakers more time. We're going to hear from Howard Cotton. He's the CEO of the International Council of Nurses. He's from Switzerland. He's going to give us sort of an overview of the whole situation of nurses on a global level. Then we have Beth Battolino. She's a registered nurse and CEO of the Healthy Women's Organization, great speaker and very much a dedicated nurse. I know the one thing that I remember her saying on the last call is that's really part of their DNA. And I know that as a nurse, I know that, they are so very dedicated, as is Beth. And then myself will be giving you just a little patient perspective of experience, actually dealing with nurses on all levels. We'll hopefully leave some time for discussion and some questions that you could put into the chat, and we will look at those. And then the closing remarks by our CEO, who's Jeffrey. Next slide, please. And these are our speakers, as I said. I'm going to go ahead. Next slide, please. So I'm not going to go ahead through this, but I'm going to let Howard go ahead and start, rather than you can read his bio on our website. So Howard, I'm going to turn it over to you. And thank you again for taking your time to share your knowledge and insight into nurses on a global level.
Penny, thank you so much. Hello, everyone. Good morning, good afternoon, good evening. I'm the Chief Executive Officer of the International Council of Nurses. I'm also a nurse, and I'm so grateful to Penny, to Elizabeth, to Hussein, to Andrew for the World Patients Association for choosing the nursing profession as the spotlight for this hugely important campaign, which the International Council of Nurses, our president, Dr. Cipriano, our entire board, our more than 130 national nursing associations throughout the world are delighted to support. One of our board members will be with you at your forthcoming conference as well. There is a very special relationship between nurses and people who receive health care. I was just looking, as I was preparing for this webinar, at the code of ethics that ICN produces for nurses. And point 1 of our code says that nurses' primary professional responsibility is to people and patients requiring nursing care and services now or in the future, whether individuals, families, communities, or populations. The foundations of our profession could not be clearer in terms of the primacy of patient and people's health care. I'm going to give you a little bit of a whistle-stop overview of the current state of the global nursing workforce today. Next slide, please. Just to say, the International Council of Nurses, I've said more than 130 national nursing associations. There are over 28 million nurses worldwide. We're in special relationships with WHO and bring the voice of nursing, not just to WHO, but the entire UN system. Our president was at the UNGA just last week, speaking and intervening at a whole range of events. Next slide, please. This image you can see is from a report produced in 2020 by WHO and in collaboration with the International Council of Nurses. It's called The State of the World's Nursing. It's difficult in a way to believe that this is the first ever State of the World's Nursing report that WHO had produced in its long history. This image that you can see shows you the distribution of the world's nurses by countries and by regions. Bluer numbers are where there are more nurses per 10,000 population. The red indicate countries with less than 20 nurses per 10,000 population. So that 29 million nurses that we have globally are not distributed evenly. We have a great inequity in terms of the distribution of our nurses around the world. But what this report also highlighted in 2020 was that there's close to a 6 million shortage of nurses. The data and the analysis that resulted in that figure of 5.9, nearly 6 million, was from before the pandemic. And we have been very concerned about the impact of the pandemic on the nursing profession. I'm going to say some more about that in a moment. And as a result, WHO agreed, Dr. Tedros at our Congress last year, that there would be a second State of the World's Nursing report, which we are working on now to be published next year. Next slide, please. As I said, very concerned about the impact of the pandemic on the world's nurses. But the nursing population is also aging. The estimates are that there are about 4.7 million nurses who are due to retire over the next 10 years. So that's in addition to the current shortage of 6 million. And then this impact as a result of the pandemic that we called the COVID effect. We did some analysis in the reports that you can see here, Sustain and Retain and Recover to Rebuild, that deep dived into the impact of the pandemic and concluded that we could be at risk of losing another 2 or 3 million nurses as a result of the pandemic. And then you see a very huge number on the far left there of that actually we need 30 million nurses more, not 6 million. That seems a big jump, you will say. This isn't ICN analysis, this is health policy analysis from people at University of Washington in the US, who looked at future health needs of the world, the fact that we're all getting older, the rising non-communicable diseases, the complexity of some conditions, and said, actually, this could be the number of nurses that we need to meet those needs. So whichever way you cut it, we have a current shortage and we need more nurses. Next slide, please. Just to give you a sense of the COVID effect that we termed it in terms of the impact of the pandemic, we saw huge mental health implications for nurses, burnout, stress, PTSD, some tragic cases of nurses committing suicide as a result of the intensity and the pressure of their work. You know that the issues that we had with lack of PPE and with vaccine inequity meant that nurses were at a high rate of being infected. We did work with the World Health Organization. It estimated that on average, an average figure could be for the number of deaths of healthcare workers through COVID around the world of 115,000. That was only based on data from half the countries of the world, so could be even more. That started to feed through into people being less attracted to go into the profession. This is a really difficult issue for us because when we advocate for safety and protection of nurses, the last thing that we want to do is to put people off coming into the profession. But people saw where there were deficiencies in terms of the support that nurses needed. There was disruption to education supplies, and there were around the world an increase in some strikes and disputes. And what I would just highlight is that when you look at where there has been some form of collective action, patient safety is very, very often at the core of the nurses' concerns that they are raising, that there are too few staff, and as a consequence, they are worried about the impact on patient safety. Next slide, please. I'm going to say a little bit more about that for you as well. You know that since the pandemic, we've had a terrible situation with an increase in conflicts in a number of regions around the world. WHO estimated a 75% increase in attacks in the last 3 years. We have had to advocate very loudly on our deep concern of where healthcare workers and healthcare facilities have been attacked in conflict zones, but not just in conflict zones. You may be familiar, there was a case just recently in India of a junior doctor being murdered at a facility, undoubtedly related to some of the deep issues of gender inequality and discrimination and gender-based violence that there's sadly a history of as well. This issue of violence against our nursing workforce has become much higher up our agenda. Our president wrote to the UN General Secretary calling for action, and we work closely with the World Medical Association, the World Pharmacists, physiotherapists and radiographers, and collectively we've also been advocating for greater safety and protection. Next slide, please. I mentioned that worryingly, we've seen in some places a drop-off in interest in younger people wanting to come into the profession. This is from OECD. This is OECD data, and it's based on asking people at 16 their interest in becoming a nurse. Yellow dots are for 2018 and the blue lines there for 2020, 2022. There has been an increase in Japan of interest. That's great. But look at the rest of these countries: the US, Norway, the Netherlands, France, Canada, Ireland, Czech Republic, Belgium, Finland. I could go on. A really concerning decline in the interest of younger people in becoming in becoming a nurse. Next slide, please. There are two other issues that are happening with the global nursing workforce at the moment that I just wanted to make sure that I had mentioned. After the pandemic, we saw a very significant increase in the international recruitment of nurses by some countries, mainly high-income countries. High-income countries who had not educated enough of their own nurses. The impact of the pandemic, aging population, increasing health needs meant that they needed more nurses quickly. And they went to a short-term quick fix solution of recruiting from overseas, but often from countries that had fewer nurses than them. So a significant number of ethical issues that we're concerned about in relation to that dynamic. I'm not going to go into the details today, but to highlight it's an important part of the picture that we're seeing around the global nursing workforce. But at the same time as we're seeing recruitment by some countries, there are other countries where there are actually nurses that are unemployed. Some of the sub-Saharan African countries, and those nurses say, look, if I can't get a job at home, then nobody should stand in my way from wanting to move and migrate. And absolutely not. We support everybody's right to move and migrate. What is common amongst these two issues? Root cause: lack of investment, a lack of investment in educating enough nurses in the higher income countries, a lack of investment in creating decent jobs in some of the low middle income countries. This is of such an issue that, again, we've written to the G20 on this issue, saying that they should be considering the health workforce as an issue of global, as a global emergency and as a health security issue that demands their immediate attention. Next slide, please. Why does all of this matter? Why do the numbers of nurses matter? A nurse representing nursing would say we need more nurses. Well, let's look at the evidence that we have in relation to nurse staffing and patient safety. We have a very significant, credible, high quality evidence base that shows where there are too few nurses, the risks of hospital-acquired infections increase, so do trips and falls, medication errors, patient experience is poorer, there's increased failure to rescue. That's when you don't quickly identify a deteriorating patient. And there's a phenomenon around miscare, which I'll say a little bit more about, the care that gets missed when there aren't enough staff, and increased patient mortality rates. Conversely, when you do have appropriate levels of nurse staffing, the nurses report less stress, lower sickness rates, less burnout, higher morale as well. So getting nurse staffing right are two sides of the same coin in terms of both patient safety and nurses' safety as well. And we were pleased that that was the focus in 2020 of the World Patient Safety Day with WHO. Next slide, please. I mentioned that some care gets missed. This is just to give you an example that if there aren't enough nurses, they have to prioritize. if you want to use a different language, some people say to me, well, it's you're having to ration care. Nobody wants to ration care. It's a clinical prioritization. But when nurses have to do that, this gives you an idea of the types of care that are missed, helping patients move, ambulation, turning patients, documentation, mouth care, interdisciplinary conferences, emotional support, patient teaching. The things that we hear from patients that frustrate them hugely in terms of having to repeat their stories many, many times, not getting clear explanations, falling between cracks of health systems, not getting good education and advice. You can see from this data that where there are few to staff, the things that would contribute to that are as a result of nurses not having enough time. Next slide, please. I said in the 2 slides ago, also the risk of higher death. This graph is from the World Health Organization European region, and it plots life expectancy against doctors, nurses, and midwives. And you can see where the number of doctors, nurses, and midwives per 10,000 population is higher. There's a clear correlation to higher life expectancy. So I don't make that claim of higher mortality or lower mortality lightly. This is just some of the evidence which supports that. Next slide, please. And this is from some OECD data as well, just to share from you. This is the OECD asking managers, physicians, and nurses whether they think that they have adequate staffing levels and that the pace of work is appropriate, is manageable, whether they can manage the pace of work. Nurses are there in the lighter pink shade, and you can see that anywhere between 30 and 60% are saying that indeed staffing levels and work pace is adequate. That means the average, I think, is just below 50%. On average, more than 50% of nurses believe that there is inadequate staffing levels and that pace of work is too high to deliver quality and safe care as well. Interestingly, managers' perceptions of safety are a bit higher than nurses and physicians, but this is OECD data, and I think it's again evidence of a big flashing red warning sign around nurse shortages and quality of care. Next slide, please. So what's to do? This is the current global strategic directions for nursing and midwifery, the global nursing strategy for the profession, agreed in 2021 by all of the member states at the World Health Assembly. And the key tenets, I'm not going to go through this in detail, but the key tenets are the need to invest more in nursing education, decent jobs, nursing leadership, and supporting nurses to innovate, to expand their roles, develop their careers, but offer new services as well. This strategy, the renewal of this strategy, will be on the agenda for the World Health Assembly next year. And we think many of these elements need to remain and to continue as well, because whilst we've seen some action, we haven't seen enough. Next slide, please. The International Council of Nurses, we celebrate and set a theme every year on the 12th of May, which is the anniversary of the birth of Florence Nightingale, for International Nurses Day. We produced this last year. It's a very simple 10-point plan. We called it a Charter for Change, the things that need to be done to support, protect, to invest in the global nursing workforce. This isn't rocket science. This is about decent work, supporting people's career progressing, having nursing leaders in healthcare organizations. These materials are all freely available on our website. So we've got clear direction in terms of what we need to do and the things that we should be acting on. Next slide, please. But as I said, we struggle often with making enough progress, and you will realize this as well, and we'll come across this, that frequently people say, we know nursing is important, we know healthcare is important, but these are tough economic times. Can we afford it? We have choices to make, and we can't always prioritise health in the same way as much as we would like to. This year, for International Nurses Day, we produced this document on the economic power of care. And we deliberately brought together evidence to show, look, everybody knows about the health benefits of investing in nurses and nursing, but let's look at the economic benefits as well. This isn't ICN researchers. We pulled researchers from places like the OECD, from academia, from the World Economic Forum. Those were where the sources for this document came from. The cost of ill health to the world is estimated to be around 15% of GDP. If we wanted any current example of the costs of ill health, the pandemic is estimated to have cost up to $3 trillion. So we know that those costs are huge, but people then say, well, what about if I put money into health? Will I see a return? Might I have to wait many, many years? The evidence in our report shows that the return on investment, the bang for buck in nursing, you get at least you'll at least double your money. If you put $1 in, you'll get $2 back. The return on investment is even higher in low middle income countries, and there's a clear correlation to increased life expectancy as well. So we've been trying to make arguments about investing in nursing, not just for the health dividend, but for the economic dividend. There's two other really important dividends that we see as well. Nursing is overwhelmingly a profession of women. 90% of the world's nurses are women. We know that their experience as nurses, they have been subject to lower pay, poorer career progression, less promotion, discrimination. When we invest in the nursing profession, it is also one way in which we can invest in addressing and closing gender gaps and gender equity and achieving gender equity as well. And the final area where we see a dividend is through the work that our nurses do is in disaster and conflict zones, where they bring not just health, but through bringing health, they contribute to peace as well. Next slide, please. You might say we'd expect the International Council of Nurses to say all of these things about the importance of nursing. This is a slide from a project that we've been doing with the BBC. It's called Caring with Courage. You can get it on our website and the BBC website. A dozen films of nursing from around the world. And these descriptors of trailblazers, game changers, pathfinders, and guides were from BBC journalists, not from ICN. When they looked at modern day nursing, when they were filming nursing innovation, these are the descriptors that they used. And the market research that the BBC have to do when they run a series like this, they have a lot of data. And this particular finding really struck me because it showed that people who watch the films are 60% more likely to consider nursing as transformative than people who haven't watched the films. And this is important, I think. Next slide, please, because we have suffered from traditional and stereotyped images of nursing. People see the care, of course, and the compassion, but they may not see the decision making, the courage, the technical complexity, and the leadership as well. These two images appeared during the pandemic. The one on the left is a Banksy of a child throwing away Spider-Man and Batman and playing with a superhero nurse, and clearly a well-intended message here. But the downside is it suggests that nurses are superhuman when they're not, and they don't need the support, the protection, and the investment. Whereas in fact, this other image, stylized, old-fashioned image, but the words from the Connor brothers, there are no extraordinary people, only ordinary people who do extraordinary things. That's the nursing profession. That's the work of nurses and why they need our investment and our support. Next slide, please. We have a global ambassador for nursing, Princess Muna Al Hussein. She was with us at our Congress last year in Canada. She talked about nurses being a force for global health. She acknowledged nurses' role not just in healthcare, but in peace, security, and economic sustainability, that we cannot afford to not invest in the nursing profession, and that we need to shift the nursing narrative from invisible to invaluable through the power of investment. Next slide, please. And I sincerely think that your campaign, WPA's campaign, is a hugely important contribution in helping us to make those shifts that we need to see. We have a big congress coming up next year. WPA have joined us at previous congresses, and all of you will be very welcome in Finland next year. You'll be thinking first, I know, absolutely, of your South Africa conference, which I'm sure will be phenomenal. Thank you very much. It's been a privilege to have a few moments to share those oversights with you, and be assured that we are absolutely behind you on this campaign. We'll be supporting you throughout, sharing, disseminating, bringing attention to the important WPA campaign. Thank you very much. Back to you, Penny.
Thank you. Excuse me. Thank you so much, Howard. It was very insightful. I have some questions for you. Hopefully we'll have time at the end for that. I think it gave us a lot to think about when it came to the nursing and the broader aspects of nursing that a lot of us don't think about a lot of times. Our next speaker is Beth Battaglino. As I said, she's a nurse. She's the CEO of the Healthy Women's. And so without any further ado, I will let Beth take over, because again, I want to try to leave some time at the end, and I want to give speakers time to sort of expand on what they want to say. Sometimes you think of things as you're talking. So Beth, take it away.
Thanks so much, Penny. Good morning, good afternoon, and good evening, everyone. And thank you to the World Patient Alliance for having me as a speaker for this webinar, and for your dedication to recognizing and celebrating nurses. There have been a few times in my life when my two worlds have collided in a good way, and this is definitely one of them. I'm Beth Battaglino, President and CEO of Healthy Women. We are the leading independent nonprofit health information source for women, and for more than 35 years, we've been dedicated to educating midlife women so that they can make informed health decisions, advocate for themselves, and prioritize their health and wellness. While I lead up this amazing organization, I was invited to speak because I'm also a practicing nurse in maternal fetal medicine. I know firsthand the challenges the nursing profession has always faced, and I will share some insights on what we are currently facing and the critical role that we play in advocacy. So, what are some of the challenges nurses face today? I'm going to be repeating a few of the challenges that Howard highlighted during his presentation just a few minutes ago. I'm going to address the three big ones: shortage, burnout, and technology, and the lack of rebuilding an infrastructure to support growth and advancement in healthcare. Let's talk about the nursing shortage. It's been ongoing, and it continues to be a pressing issue driven by the aging workforce, increased demand for healthcare services, and high turnover rates. I'm briefly going to take you back to the COVID pandemic. This affected all of us around the world. Nurses were working under enormous pressure, providing care to sick and dying patients during the pandemic. Many of us were faced with increased stress, and it really took its toll on us, physically, emotionally, and mentally. We had single moms with no daycare. We were caring for aging relatives, and many of them living with compromised immunosystems. Moms of young children who struggled with work and now were instantly becoming third-grade teachers. And our pregnant colleagues. When this started, there was no vaccine. We also were faced at the end of each shift with the possibility of infection or death from COVID-19. While we were taking care of our patients, no one was there taking care of us. We saw a mass exit of nurses post-COVID, and we are still feeling the effects. We are now facing retirement of older nurses. Did you know 1/3 of RNs are nearing retirement age, which will further exacerbate the shortage as they leave the workforce? The second challenge I continue to see is burnout and mental health concerns. The emotional and physical demands for nurses, intensified by the pandemic, has led to significant burnout among nurses. The ongoing pressures we still see, including long hours, the emotional strain from patient care and not enough nurses and support staff, and the limited mental health support and wellness initiatives that we know are essential for retaining a healthy workforce are still not adequate. We're nowhere near 100%. We're improving, but again, nowhere near 100%. The third challenge that I see is the integration of technology and telehealth. As healthcare increasingly adapts to new technologies and telehealth services, which we all applaud, telehealth was a game changer during the pandemic. The ability to have online sessions with mental health support, online visits with healthcare practitioners was so important and helped millions. However, as new technology advances, we nurses must adapt to these changes, requiring continuous training and support. So now we're balancing technology use with personalized patient care, which presents another level of challenges, particularly for those who may be a little bit less tech savvy or resistant to change. What has not happened is building out an infrastructure to support the advancement and integration of technology and telehealth into our practices. Staffing shortage, high burnout rate due to little change or support, and an inadequate infrastructure within the healthcare system to support the training and transition of new and important technology and policies, but more importantly, access to the people that need it the most, our patients and the underinsured or uninsured patients. Now let's shift to advocacy and the important role it plays. Slide 3, please. Advocacy plays a pivotal role in nursing, serving as a cornerstone for delivering patient-centered care and promoting health equity. Nurses act as the vital mediators between patients and the healthcare system, ensuring that our patients' voice are heard and their rights are upheld. We are the ones that are educating individuals about their health conditions and treatment options. We are always empowering our patients to make informed decisions about their care. And furthermore, nurses advocate for vulnerable populations by addressing social determinants of health, such as where you were born, where did you grow up, where are you working, where do you live now, as well as age. Advocacy works to eliminate disparities in access to care. Now I'm going to spend some time on the multifaceted roles we play in patient advocacy and community health and policy advocacy. Nurses serve as an essential advocate at every level of care. In patient advocacy, we're the ones that ensure that individual needs, preferences, and rights are prioritized. It's nurses that help patients navigate the complex healthcare systems and make informed decisions about their treatment. In the realm of community health, nurses are actively engaging with local populations to identify health needs. They promote preventative care, and we develop initiatives that address public health challenges such as vaccination drives, blood pressure screenings, diabetes and nutrition education and testing. And we're constantly reminding our communities about the importance of preventative screenings such as mammograms and prostate screenings, and so many other health education programs that we identify and customize to meet the needs of our communities. Community health advocacy. Additionally, nurses take on a vital role in policy advocacy. Yes, nurses are hard at work, working to influence healthcare legislation that promotes equitable access to care and supports the nursing profession. All of us can and should be participating in advocacy efforts at both the individual and systemic levels. Nurses not only enhance patient outcomes, but we also contribute to the overall health and well-being of our communities. Slide 4, please. What advocacy role do we as nurses play in ethical, interdisciplinary, and education and awareness? Well, nurses play a vital role in advocacy, embodying ethical principles that prioritize patients' dignity, autonomy, and informed consent. We often serve as the voice for patients who may be unable to articulate their needs or preferences due to illness, language barriers, or other challenges. By recognizing and addressing ethical dilemmas, nurses ensure that patients' rights are upheld and that their care aligns with their values and their wishes. This commitment extends to promoting health equity. As nurses, and as nurse advocates for vulnerable populations, we are working to eliminate disparities in access to care and constantly trying to improve health outcomes. Our deep understanding of patients' experience allows us to advocate for systemic change. We all have a story we could share on how we would do things differently on our floors, in our hospitals, in our communities if the pandemic happened again. I know I do. I'm going to quickly walk you through how I would advocate for the change through communication. Advocating for my patients' access to better care and better outcomes. So as I stated before, I'm a nurse on maternal fetal medicine, but I was floated one day to the med-surg floor in my unit during the pandemic. Our med-surg unit was a holding, basically a holding floor for patients that just had knee replacement or hip replacements. Our rehabilitation centers were filled with COVID patients that were on vents. And so patients that just had surgery were not able to be discharged to rehab centers. We had to keep them in the hospital, and the med-surg floor served as that holding floor. And so when I was asked to float over to the med-surg unit, my role and responsibility was answering the phone and the call bells. I wasn't doing any hands-on patient care. And what I quickly realized is the phones were ringing off the hooks, and it was all patients, family members that were calling in asking about their loved ones because they could not get a hold of them. They were not getting updates. They wanted to know how they were doing. And so what I quickly realized is that this didn't have to be a nursing role. A nurse could oversee it. We could have invited someone from the community. There were so many people wanting to help and raising their hands. There were so many retired nurses that wanted to come back in and help during the COVID pandemic. But setting up almost like a command central where we could return those phone calls, understand what the patient's needs were, understand who their family members were, and just call the patient's families in the morning and the evening to give them a status update, to make sure that the patient's laundry was dropped off at the main entrance of the hospital so the patient's family could pick it up and leave fresh laundry for the patient to change into. Even accessing the patient's family through the iPads that were given to each patient in the hospital during their stay, but many of these patients didn't even know how to operate an iPad they did not have the ability to FaceTime because they didn't understand the technology. Simple fixes that could have made a huge impact on that patient care. Again, advocating for my patient, access to better care, and health outcomes. It's simple but important. Communication providing a sense of personalization, care, respect for our patients and their families. Ethical advocacy. In addition to ethical advocacy, nurses play a crucial role in interdisciplinary collaboration. We're bridging gaps between various healthcare professionals to ensure comprehensive patient care. And I bet many of you are now shaking your heads. Yes, we are all about collaboration. We want to help. We want to connect patients to everyone who is taking care of them. Nurses love to connect the dots. We love team-supported care because we know it works. We're the ones that are facilitating communication among team members, working with doctors, specialists to translate complex medical information into understandable terms for patients and families throughout that patient's stay and follow-up. How many of you, after the doctor left the room, has had to review again with the patient instructions on their care, what the form was that they just signed, what follow-up was going to entail? This collaboration, this communication enhances the effectiveness of care plans And as nurses, we make sure to incorporate diverse perspectives and expertise, leading to more holistic approaches to patient health. Moreover, nurses engage in education and awareness initiatives. We equip our patients and communities with essential knowledge about health issues, preventative measures, and available resources. Through workshops, community outreach, and individualized patient education, nurses empower individuals to take charge of their health, fostering a culture of informed decision-making and proactive health management. Advocacy is not something new. We have always been advocating for our patients, communities, and our profession. It's a core component of nursing practice. Advocacy on multiple levels is critical in an ever-evolving healthcare landscape. It empowers nurses to effect positive change for their patients, their communities, and the nursing profession as a whole. By actively participating in advocacy efforts, nurses help shape a more equitable, a more effective, and a more compassionate healthcare system. Thank you.
Thank you so much, Beth. This was really informative. And I see there's a lot more questions in the Q&A. I'm hoping we can get to them. If not, I know that they will be answered and because they're collecting those. So the next is my presentation on the patient's perspective of nursing. Next slide, please. And it's something that, unfortunately I have recently experienced. Next slide, please. So my question to you is, what if you were in a hospital and rang a call bell and no one came? Or you were in a recovery room after a procedure or an operation and there was no one there to care for you. I just imagine that. Or a woman who was giving birth. There's no one there to provide comfort, reassurance, and make sure that they were okay. Or you were a wounded soldier and you found yourself alone and forgotten as they wait for the only doctor who's 100 soldiers. Who is always there? It's the nurse that's there. They're the ones that, and the sad thing is with the lack of nursing today and the lack of numbers of nursing, some of these questions are going to be, we don't know who's going to be the one. Who is going to be the one to be there? Next slide, please. So there are the many what ifs. There are many what ifs, but there's only a nurse that can provide all those things. It is only a nurse that can do that. And I don't think that we really appreciate the role that they play. And what's really interesting is the number of different specialties. We think of a nurse as a nurse, but we don't realize the number of different specialties and that they're into, just like a physician or a healthcare provider. They have specific, whether it's like Beth said, she has one area that she usually works on. There's the OB nurses, there's the ones who work in the operating room, there's the peri-anesthesia nurses that work on the, before and after of surgeries. There's all different kinds of nurses. There's the anesthetic nurses that actually are in the operating room with you, providing you with the anesthesia. So there's many different kinds, and I don't think we realize how specialized many of these men and women are. Next slide, please. So recently I find myself how valuable a nurse really can be. We don't really think about it, but whether it's in a doctor's, a hospital, operating room, emergency recovery department, no matter the situation, there's always a nurse there when no one else is. They provide comfort, care, and needed information. As Beth said, they're an educator as well as a caregiver, and the reassurance that we need. Next slide, please. And I'm rushing through this because I see our time is short. So imagine any healthcare, again, without a nurse. Next slide, please. So I cannot imagine that if you had been left alone for hours on end, and this was something that I actually experienced when I had a stroke, and there would have been no one there in those first critical 24 hours, what amazed me, and I was really shocked, that a nurse actually stayed with me. They had to stay with me those first 24 hours. There was actually somebody in my room all night, all day, and stayed there to check on me just to make sure I was okay. I cannot see anybody else. A physician, a doctor, nothing against them, but that's just not their role. It's the nurse that's the one that's there. And it was that reassurance that helped so much. I mean, you're sitting there and for me, it was like I couldn't move. My whole right side was just totally immobilized. It was scary. It was one of the most scary things of my life. You just see all these things going through your mind as that happens. You need that reassurance. You need someone there to just sort of comfort you. It just it's a lot of times, you don't even have to say anything, just the fact that they're there and they're checking on you. And if something goes wrong, they're going to be care of you. Next slide, please. So, what do they need? They need reduced working hours. What I was shocked to find out is they work 12-hour shifts. Most of us an 8-hour shift. Nurses, at least, and this is in the US, they work 12 hours a day. That's on their feet, on call, whenever you need them. The pay that they get is not equal to the amount of education and work that they do. They need increased pay. That's one way to begin to keep more nurses. They need better working conditions. And we don't think about that. Again, and it was interesting when Howard talked about the safety of nurses and I didn't really realize how bad it was until I was involved in calls with the International Red Cross, and their whole focus was on the safety of healthcare workers. I kept thinking, oh, safety of patients. No, the healthcare workers themselves. I mean, they do lose their lives and think about it, in the battlefields. I mean, they're out there. They're out there on with the soldier. They're there. They are always there when you need them. They need better working conditions. They need mandated time off for professional development opportunities. Just like physicians, just like everybody else, things change, especially in medicine. It is so rapid. I just had a call with my husband. He's going to have a procedure. When I made the appointment 3 months ago, they said he has to stop this medication. And when I called to double check, they said, no, it's already changed, that those things have changed. So medicine is really evolving all the time. If they don't have time off to go and learn the new procedures, the new rules, the new, what's been discovered and how to take better care of patients, how are we expecting them to take better care of us? They are extremely educated. They know and they need that time off to continue to improve the education so that they can actually take the best care of you. They need, obviously, and we've heard this, the number of nurses that we need to increase those number of nurses. And I saw this again when I was in the hospital several different times over the last few years. Most of the nurses that were caring for me, there were a few that were actually local that lived in the area, but the majority of them were what they called traveling nurses, and they travel around depending on different parts of the country when they're needed. Many of them are coming from other countries. They're not here. They're coming here because this is where their need is, and I was just totally surprised. I was never, because when I had my children many, many years ago, nursing was very different. It was so different than it is today. You can see the difference in the amount of responsibility, the amount of stress, the amount of effort that nurses put into your care, and access to better medical equipment and supplies. And we saw that clearly in COVID. We weren't prepared, and that's very true. But they still, on a day-to-day, they still need better medical equipment and supplies. In many parts, even in the US, but around the world, they need better supplies and equipment. Next slide, please. So, what can you do? Tell a nurse how much you appreciate them. We're going to do some of that when we're at our conference in Cape Town. Support their policies. Talk to a nurse. And find out what is it that you can do to help them support what they need. Make others aware of the challenges of nurses. I think we take, something that's always there, we take it for granted. I do a lot. I used to do a lot of traveling and flying, and sometimes there were medical emergencies on plane, and they'd ask, is there a healthcare? It's always a nurse that steps up. It's always a nurse. They're always there, and it doesn't matter whether they're in the hospital or in their daily lives. They are a nurse 24/7 all the time. It does not matter. They don't stop being a nurse just because they leave the building or leave the office. They're a nurse all the time, and they're there to help no matter what, which I find extremely heartwarming to know that they're there, and they're out there everywhere. Advocate for better pay and higher wages for them so that we can keep our nurses. As they said, we're seeing a lot of retirement happening, as the nursing community ages. We need to make sure that it's attractive for people to go into nursing and stay into nursing. I read somewhere that a lot of the nurses that start, they may last a year and then they quit because it's too hard, it's underpaid, it's just too hard for them. Excuse me. Organize community events in support of nurses and their needs. You as a patient organization, take on that challenge to organize some kind of community event to tell your nurses in your community how much you appreciate them, how much they're needed. A few kind words go a long, long way, and encourage our youth to think about the nursing careers that they have, that they may have. It is an honorable profession. It is one of the most rewarding professions. It is one of the most necessary professions. And I don't know that enough. And you saw the number on Howard's one slide, the number of people who used to think about going into nursing and do now. And again, I think that's something we need to talk more about our youth. I mean, the whole idea of the nurses has changed our vision of who they are. Next slide, please. So nurses, because we live in a happier world because of nurses. Without their care, like I said, imagine if they weren't there in all the needs that you've had over your lifespan as a patient. Where would you be without that tender, loving care and compassion of a nurse? So I know we have 6 questions. I have questions too, but it looks like we have 1 minute left. So unfortunately, we're not going to get to the Q&A. I'm going to turn it back over to Hussein to wrap this up. And I want to thank all of our speakers, extremely informative, very heartwarming. So Hussein, do you want to take it away?
Yes, thanks, Penny. And I'm extremely proud of our campaign, Heart of Healthcare Celebrating Our Nurses, which basically addresses the critical nursing shortages and the key factors driving this crisis. Our campaign aims to celebrate and support nurses, raise awareness about the challenges they face, and advocate for better working conditions. We have planned a series of activities around this campaign, and you can get more information about the campaign and the activities on our website, www.worldpatientsalliance.org. Then taking this opportunity, I would like to extend my heartfelt thanks to our speakers, Howard Carton, who is the CEO of ICN, Elizabeth Bettelino, she's the president of Healthy Women, and Penny Covan, who is also the secretary of World Patient Alliance. Their insightful presentations have shed light on critical issues nurses face globally, and I really appreciate their contribution to this important conversation. I also want to thank all the participants in today's webinar for dedicating your time to this vital cause. And our special thank goes to Johnson & Johnson for recognizing the seriousness of this issue and supporting our campaign. Your belief in the importance of addressing nursing challenges underscores the need for the stronger collaboration between patients and nurses as we work, towards much needed improvements in the working conditions worldwide. So big thanks to all of you. Next, please. Next slide. So, just before I end, I just want to, inform everybody that we are organizing our second World Patient Conference in Cape Town on the 19th and 20th of this month. So the registration is totally free for virtual participation. If you have not already registered, please do register, visit our website and register yourself. It's totally free of cost. Thank you very much, and over to Penny.
Thank you, Hussein, and thank you again for everybody who took the time to listen to this. It is recorded, it will be on the website. You can watch it again. All the information, the websites and everything will be there. So again, thank you. And thank you very much for our speakers for taking the time to share your insight. I know that there's a lot more that can be said, but again, the bottom line is that nursing is the heart of healthcare. And without them, I think healthcare would look a whole lot different. So thank you all and have a good day. Have a good evening. Have a good afternoon. Bye.
Yeah, bye-bye.